we try to make these averages and bell curves and try to make claims that include everybody. But I always tell people you're an N of one. Every person is an individual. You're
Yeah, yeah,
not on a, you're not a statistic. Every person is an individual.
yeah, yeah.
You're not a statistic. You don't know where you are on that curve. And it doesn't matter about the curve. It matters about you. And I mean, we tell that with patients when they're like, with cancer and stuff, like, how long do I have to live? And I'm like, I would never tell you that. Like,
No telling.
why? How would I know that? I can give you a statistic, but that doesn't mean you're part of it. And it's the same thing with a lot of these other claims we make. So I've gotten way more comfortable getting away from the lab range algorithms to trial and error and just being honest with people that this is going to take trial and error and it's okay. And your labs aren't going to tell you. It's not like we have a little decoder ring that we can wand over you and your blood work just tells you everything that's wrong with you. It just doesn't work like that.
Yeah, yeah. And there's one thing I've noticed: the more I practice, the more you realize that labs are just they're just labs. It's just a number. I mean, that just because you're
Well,
here
tell you
doesn't mean
something interesting. So this was interesting. So the patient that came to see me on Friday is a biochemist and started his own biotech company. So synthetic chemicals like drug discovery, all that. He didn't realize that the reference ranges for testosterone were not based on therapeutic ranges when given a drug. Because in his mind, that's how it works with drug discovery, right? When they're looking at blood levels, it's based on the drug and the effect. And I was like, no, these are just baseline levels for people not on testosterone. They literally have no meaning when you're taking an exogenous substance. I know people have a hard time understanding that because they're just like, no, I just want to get back into the normal range. It's like it's two separate issues. When you take something exogenously, you change a lot of stuff going on in the body. So trying to get back into that normal range, well, there's a reason most guys don't feel great when they just get back to normal, right? And I think Keith Nichols talked about that in one of his recent interviews about
hmm
the reference ranges and how most guys need to be above that to be and it's true. I mean, in practice, it's true. I mean, and I think that's where people have a lot of issues because they want a cookie cutter range to go. I want to get there and I'll be fine, and it just doesn't work like that.
sure. And that it's no different when people say, "Well, if I just had $100,000, life would be great." And then, okay, well, you're there now, but shit ain't changed. You're right
That's
where you
right.
were.
That's right.
It's
Yep.
that's the concept of chasing numbers is that it's just a number and there's no meaning behind a number. I don't think people
Yeah,
can
well,
grasp
especially
that.
when there's so many variables going on in the body that you don't even know what all the variables are. So we make these assumptions like we know it all, we can control. And first of all, nobody ever controls for those variables. You can't in a living human. First of all, second of all, you don't even know what all variables are there going on. So just because you get a number and you try to correlate it with a symptom, that's just correlation. It doesn't mean it's causative. There can be so many other factors that might be causing both issues, right? And we see that all the time. And so it's just, I think more people are starting to catch on to that, but it's a hard concept, even for people in research, because they want hard data, quote
They
unquote.
need benchmarks and
Right.
numbers.
That sounds great, but that's the methodology that you have chosen. You did not discover that that's the right method. You chose that, and then you hone in on it when it's like, well, but what if it's this other method? What if it's symptom based? Like you're not, and I mean, that's a philosophical discussion. Same thing with laws of nature. People choose the equations they want. They're not discovered. Like, and that's fine to try to hone in on something you're looking at. But in research, medical research, certain outcomes are chosen to look at, and then everything's structured to try to find that outcome when it's like that might not be the proper outcome.
Sure.
Like does do AIs lower estradiol? Yeah. So what?
So
Why would
what?
you want to do it? You know, like eh, it's just so it's a different mindset. And I'll have guys like, well, look, they did these studies with AIs and they brought sperm counts back up. Yeah, we know that's not the point. You know what I mean?
Okay.
Like, so what? So yeah, I think more people are catching on. I hope. I don't know about mainstream medicine. They're still very much lab focused.
Yeah.
I have guys all the time that tell me that their providers, they're like, their hematocrit's 50.1, and they're like, oh, you're getting a stroke. And it's like, are you kidding me? Like the normal range used to go up to 55. Like,
Yeah.
it's just sense.
And
So
I've
actually,
actually got some clients like in Arizona, and some of their labs goes up to the hematocrit range goes up to 60.
exactly.
And I'm like, no, if you're normal on this one, but you're not on this, then at what point is there any discretion that this is good or bad? You can't discern that. You can't define that.
I liken it to when they changed speed limits. It's like, so it used to be wrong to drive 70 when it was 55, and now it's
Oh
75 and
yeah.
it's okay. So what, you know what I'm saying? It's kind of a similar thing.
It's
So
like
it's okay
statutory
now.
medicine.
Yeah, exactly. Like, oh, we're gonna grandfather you in. That's what I tell them. Like, I'm gonna grandfather you in back to when it was 55. Like, it doesn't matter. I mean, there's other things going on. I mean, the hematocrit issue is a whole nother topic, but just things like that. I think as long as we get away from the pure reference range mindset, I think you start seeing people actually feel better if
Feel
they get
better.
out of
Hmm.
that too. The